Nurses have been worked to exhaustion across the country due to the COVID-19 pandemic. According to the BC Nurses Union, it is no different in Fort St. John, where we are experiencing nursing shortages. What do you propose needs to be done to aid the recruitment and retention of nurses in the city?
Thank you, Trey. And we're going to start this round of answers to the questions actually with Sarah McDougall. Sarah?
Well, this is near and dear to my heart. And this is not new to the pandemic. We have had nursing shortages in our city as long as I've worked for Northern Health. We need to focus on creating a community that workers want to come to and to stay in, to marketing ourselves towards people whose values would align with what we have here in Fort St. John. So that active lifestyle, the vibrant community, the small town mentality with a big heart, hard workers. We also need to take a step back, get into our schools and grow our own so that we are encouraging young students to get into the healthcare field or other fields that are in need, so that we are having people who were born and raised in this region get the schooling needed. For example, we do have the nursing program here locally now, so that they come back and work in Fort St. John, because we know that people who are from here are more likely to return here or stay here once they've been educated.
Thank you, Sarah. Tristan?
Just like Sarah, this is a topic that is quite near and dear to my heart as well. I've been standing shoulder to shoulder with nurses all throughout this pandemic at one of the largest hospitals in British Columbia. They have done some tireless work, and I really empathize and feel for them right now as this pandemic draws on. One of the things that I think we need to address, and I think be realistic about, is we need to instill trust in the healthcare system, and we need to instill trust in the science. I think that there has been a lack of honesty about how we feel towards healthcare, especially during this pandemic in our community. And I think that we need to provide a place where nurses can feel safe doing their jobs and also feel accepted doing their jobs. A lot of nurses in British Columbia are minorities, and we need to provide a community that is safe and accepting of their profession and the people that they are.
Thank you very much, Tristan. And Jim, your turn.
Yeah, thanks for the question there. And, all very good answers, but this has been an issue for many, many years. I've lived up here for 35 years, and we always have a trouble, retaining doctors and nurses and healthcare professionals. And, it's going to be an ongoing problem. We have now an economic development group working for the city, and, it's their job to sell the city. So between Northern Health and the Economic Development Group in Fort St. John City, we have to address that, why we can't get doctors and nurses and healthcare professionals up here. I mean, it's a really family-friendly city, and it's just a matter of advertising. I mean, the fact of the matter is, we do live in the north, and a lot of families like to live in the south. So we just have to do a better job of selling Fort St. John to the doctors and nurses and healthcare professionals.
Thank you very much, Jim. Thomas, your turn.
Thank you so much. I think so. Keeping the nurses here, or getting the nurses to start here, I think is really, really important. Programs like the nursing program that is opening up at Northern Lights College here in September will be a huge catalyst into making sure that, as said previously, we can grow our own and keep them in Fort St. John. On top of that, we need to ensure that we have the amenities to keep these people here long term. Not everybody has the exact same interests in life. I'm sure everybody can appreciate that, and everybody on this call can appreciate that. But we need to diversify on what activities we have available for people. Not everybody's going to like just going for hockey. Some people are going to like rock climbing in the middle of winter, whether that's a rock climbing wall, the new multiplex that's going on. Aspects like that are why people stay in the community, as well as giving back. And we need to champion our non-for-profits to bring these people in and make them part of their community.
Thank you, Thomas. And next, Jonathan.
Well, I'm not going to lie here. Sarah and Tristan said some very, very important facts. We do need to start them young. We need to get things going on in the schools, and that nursing program that's coming into Northern Lights College is a big bonus here for Fort St. John. It's in fact something when I first thought about running, I immediately talked to the council members and said, hey, how can we get a program in our high schools so that when high school students graduate, they want to get into this field. And I think we need to promote how good of a field it is to our younger generation. And I also agree with Tom. It's we got to have those things in place for families when they come up here. You know, I'm a big fan of volunteering in nonprofits. I work with them every day. And if we can get people more involved in helping the community, they'll want to stay in the community.